Today, we're diving into something that might sound a little intimidating: psychopathy. But don't worry, we won't be jumping to conclusions or diagnosing anyone. Instead, we're going to explore the key signs and traits that might help you understand if you could potentially exhibit psychopathic tendencies. Before we start, it's important to remember that psychopathy is a complex and serious psychological condition. It's not something to diagnose lightly. But by understanding the traits, you can gain insights into how personality disorders are evaluated. And maybe, just maybe, some of you will recognize some familiar patterns. So what exactly is psychopathy? It's often used interchangeably with terms like sociopathy or antisocial personality disorder. But it's important to note that they aren't exactly the same thing. Psychopathy is often seen as a more extreme form of personality traits linked to a lack of empathy, impulsivity, and manipulative behaviors. Psychopaths are often very charming and appear normal on the surface, but they may lack empathy, have shallow emotions, and engage in reckless behavior without any regard for others. This can make them seem callous or even dangerous in extreme cases. Now, let's talk about the key signs that might indicate psychopathic traits. These are some things psychologists look for when evaluating whether someone might be a psychopath. 1. Lack of empathy. One of the hallmark signs of psychopathy is a lack of empathy. Psychopaths tend to be emotionally detached from the suffering of others. If you find that you struggle to feel bad when others are in distress, or find it difficult to put yourself in someone else's shoes, that could be a red flag. 2. Superficial charm. Psychopaths are often very charming, perhaps even too charming. They know how to manipulate people, make friends, and fit in with society. They can be smooth talkers and seem charismatic, but their charm is often a mask for their lack of deeper emotional connection. 3. Manipulativeness. Manipulation is another major trait. Psychopaths can be very skilled at influencing others for personal gain. If you notice that you often get people to do what you want, whether they realize it or not, it might be worth reflecting on how you do it. 4. Impulsivity and risk-taking. Psychopaths tend to engage in risky behaviors without thinking about the consequences. Whether it's reckless driving, gambling, or other dangerous activities, they don't seem to fear getting caught or hurting others. If you often engage in behaviors that others would consider risky and don't care about the fallout, this could be another indicator. 5. Lack of long-term goals. Psychopaths often don't have long-term goals, or at least their goals are self-serving and short-term. If you often find yourself only focused on immediate gratification without thinking about the future, that could be a key trait of psychopathy. Now, there's another concept you might have heard about: the Dark Triad. This refers to 3 personality traits often associated with psychopathy: narcissism, Machiavellianism, and psychopathy itself. Narcissism is about grandiosity, while Machiavellianism is about manipulation for personal gain. While these traits don't always overlap, psychopathy tends to include them, making someone who exhibits these traits more likely to show signs of psychopathy. You may be wondering, is there a difference between a psychopath and a sociopath? While the terms are sometimes used interchangeably, they do have some distinctions. Psychopaths tend to be more calculated, less prone to emotional outbursts, and often better at hiding their traits. Sociopaths, on the other hand, tend to be more impulsive and less able to maintain relationships or function in society. Sociopathy is often linked to environmental factors like trauma or abuse, while psychopathy is believed to have a stronger genetic component. You might be wondering, can psychopathy be treated? While psychopathy is often seen as difficult to treat, research suggests that certain forms of therapy, such as cognitive behavioral therapy, CBT, can help individuals with psychopathic traits learn to manage their behaviors. However, the success of treatment can vary greatly from person to person, and not everyone with psychopathic traits will be open to treatment in the first place. So, after hearing all of this, what should you do if you recognize some of these traits in yourself? First, don't panic. It's important to understand that traits like these exist on a spectrum. You might have a few signs, but not necessarily be a psychopath. Self-reflection is key. If you're concerned, it might be worth talking to a professional, a therapist or psychologist, who can help you understand these behaviors and whether they are part of a larger pattern. It's always better to address any concerns with expert guidance. Thanks for watching. I hope this video gave you a clearer understanding of what psychopathy is, how to recognize the traits, and what to do if you identify them in yourself or others. Remember, the goal is self-awareness, not self-diagnosis. If you found this video helpful, don't forget to like, comment, and subscribe to get smarter every day with our channel. And as always, take care of yourself and those around you. See you in the next video.